Welcome to Salud Primero Health and Symposium. This is Marilyn Andrade, Director of Events and Activities. On behalf of the Morris County Hispanic American Chamber of Commerce, I will share a few tips to ensure that you have the best experience today. All participants will be muted and we will only be able to view video from our panelists today. If you have questions, I invite you to use the Q&A box located on your Zoom controls. The Q&A will be moderated throughout the symposium. Please stand by for our special Q&A and we may address your question. And now I introduce you to Ms. Esperanza Porras Field, Founder and President Emeritus of the Morris County Hispanic American Chamber of Commerce.
Buenos dias, how's everybody out there? Thank you for attending the symposium today. On behalf of the Morris County Hispanic Chamber of Commerce and the United States Hispanic Chamber of Commerce, I'd like to welcome you to our health symposium, Su Salud Primero. The purpose of this event is to educate you on the impact of COVID-19 on the Hispanic community. We are honored to have the USA Surgeon General Adams as our keynote speaker, as well as a distinctive panel of experts on the medical and small community addressing the obstacles facing Hispanics seeking healthcare assistance while highlighting the purpose and options available to them and the implementation of solutions to ensure the health and safety of our community. Thank you for attending and thank you for the panelists to accept our invitation. Now, it's an honor for me and a pleasure to introduce you to our Morris County Hispanic Chamber of Commerce Chair, friend, and colleague, Ralph Tejeda. Thank you.
Thank you, Esperanza. Good morning, buenos dias for everyone. It's a great pleasure to have everyone here. I would like to thank our sponsors for powering this event, Coca-Cola Company, Wells Fargo, and Healthfirst. We couldn't have done it without your generous contributions. I would also like to thank the United States Hispanic Chamber of Commerce because this is a joint effort. Next, I would like to introduce Hope Field. Hope is the Senior Manager of Latin Affairs for the Coca-Cola Company. Her role serves as the National Spokeswoman for Coca-Cola North America, where she manages the company's efforts to strengthen relationships across the East Coast, including Puerto Rico, focusing on including Puerto Rico, focusing on the United States Hispanic community. Hope manages with local key state and national Hispanic political, community, business, and civic leaders. Currently, she is a corporate advisory councilwoman and immediate past chairwoman for United States Hispanic Chamber of Commerce. She serves as United States Hispanic Chamber of Commerce's Senior Corporate Advisory Board and Unidos Corporate Advisory Board. Thank you, Hope. This is a new role for me. Prior to being the chairman, I was a secretary. You've taken me under your wing. You're a kind and a compassionate, smart, and dynamic woman. It's always great working with you. Please take it away.
Thank you kindly, Ralph, for those words. That means a lot to me. And it's been my absolute pleasure. There's no one else that could have filled my shoes, so I really appreciate it. Bienvenidos. On behalf of Coca-Cola, welcome to the Salud Primero Health Symposium. The United States Hispanic Chamber of Commerce and the Morris County Hispanic Chamber of Commerce partner together for this event. We are proud to support both organizations and serve on both corporate councils. Coca-Cola has been a partner with the United States Hispanic Chamber of Commerce since its inception 40 years ago. That's right, 40 years ago. We are proud to support our Latino business community. Thank you to Dr. Jerome Adams, our US Surgeon General, for being our keynote speaker and for your leadership during these difficult times. Our deepest condolences to those of you who have suffered a loss during these trying times. This has been life-changing for all of us. And whether you are a business owner or parent homeschooling, we have all been impacted. I would like to share with you a short video of gratitude from Coca-Cola.
For those living together and those living apart. For classmates, graduates, and teachers making the best of it. For the restaurants delivering to our doorsteps. For the frontline workers putting it on the line every single day. For this great nation, determined to be stronger on the other side. Thanks to all of you, we'll be together again.
Thank you to all of you for everything that you've done. I would also like to share with you some of Coca-Cola's COVID-19 relief efforts. The Coca-Cola Company and Coca-Cola Foundation are making contributions to support relief efforts around the world. We are also redirecting a big part of our marketing spending for community relief programs, medical supplies, and equipment during the outbreak.
These contributions will take our total community support beyond $100 million.
The company and the foundation continue to assess opportunities for grants, donations, and other support around the world as the crisis evolves. Needs are being evaluated locally. Coca-Cola has also given each employee in the United States and in Canada $100 to spend at local restaurants.
This effort adds up to an injection of nearly $1 million into the restaurant industry. Also, Coca-Cola has shared both uplifting messages of solidarity and COVID-19 prevention tips. On the screen, you can see our billboard that went up in Times Square in New York City to stress the importance of social distancing. We are confident that the communities we proudly call home will get through this by working together.
I hope that you drink your favorite Coca-Cola beverage today throughout the health symposium. Mine is Smart Water. I think it's a good choice. And enjoy the conference. Next, I have the pleasure of introducing Regina Hayward, Senior Vice President and Head of Supplier Diversity for Wells Fargo and Company. With more than 2 decades of multi-industry global supply chain and supplier diversity strategy and experience, she is responsible for developing and engaging certified diverse suppliers to integrate them into Wells Fargo's sourcing and procurement process. Throughout her career, Regina has been known for developing high-impact supplier diversity programs and leading strategic supply chain initiatives in North America, Asia, Latin America, and Europe. Currently, she serves as a board member of the United States Hispanic Chamber of Commerce. She also serves on the Charlotte Chamber of Commerce Board of Advisors. Regina has been featured 3 times by Diversity Plus as one of the top 25 women in power impacting diversity, and has received numerous other recognitions for her leadership in diversity, including honors from Minority, Business, News, and Diversity, Inc. I've had the pleasure of knowing and working with Regina for some time, and all these honors are well-deserved. She's a longtime advocate of the Chamber and the business community. And without further ado, I'd love to introduce you to Regina.
Thank you so much, Hope. It is a pleasure to be here today, and I am super excited about the journey that we're going to embark on together. Let me say welcome, everyone, from my colleagues at Wells Fargo, over 260,000 of us, and on behalf of our CEO, Charlie Scharf. It is a pleasure to support this effort today, as well as it's a pleasure to have built an enduring relationship with the Hispanic community. You know, we all care so much about ensuring that Hispanic-owned businesses grow and thrive within the United States. As Hope mentioned, I am a member of the U.S. Hispanic Chamber of Commerce's Board of Directors, and I serve as the audit chair, and am so pleased at the network of corporations and local chambers and others who are supportive of the mission and the vision of USHCC. When I share our commitment, I like to really put the numbers behind how committed we are. At Wells Fargo, we spend over $140 million a year with Hispanic-owned businesses. Latina businesses are supporting us at a very high level. We have relationships with organizations who are broadening our retail branch network, who are supporting our marketing and advertising, who are key participants in our consulting and professional services opportunities, not to mention the brick and mortar trades like construction and facilities and HVAC. We are all in when it comes to engaging Hispanic-owned businesses at Wells Fargo. And as Hope talked about the unprecedented time that we're going through in relation to COVID-19, we certainly have stepped up to address the needs in a very action-oriented and tangible way. We announced that we are donating our $400 million approximately of PPP fees to small business supporting organizations so that our businesses can retool and recover and restore across the country. We are sowing into CDFIs, those are community development financial institutions, because we understand that local providers of capital are also go-to resources within the Hispanic and other diverse communities. We've already afforded over $175 million to small business supporting organizations like USHCC and others. I'm also pleased that as the pandemic got started here and we began to have quarantine and social distancing, one of the things that we did with USHCC was ensure that we provided micro grants to local Hispanic chambers so that they could immediately begin providing technical assistance to Hispanic-owned small businesses. So I'm here today to say we're going to continue to work together. We're going to continue to collaborate. We will absolutely get through this connected. And my hope is that we will be a stronger country when we get out of this unprecedented time. Thank you for the invitation. I look forward to participating on the panel. And if there are any needs, feel free to reach out to me or others at Wells Fargo. Thank you so much.
Thank you, Regina. I also have the honor of introducing Trish O'Keefe. Trish is the president of the Morristown Medical Center in New Jersey and chief nursing officer and vice president of Atlantic Health System, one of the leading healthcare organizations in New Jersey. Morristown Medical Center has been rated the #1 hospital in New Jersey by US News and World Report 3 years in a row now, and is nationally recognized for quality, excellent patient experience, and outcomes.
Trish is exclusively responsible for Atlantic Health System's cardiology, oncology, orthopedic, pediatrics, and women's health service lines.
She oversees a system-wide approach for Atlantic Health System nursing and patient experience. Trish, you're a role model for so many women. We're so proud of all your efforts. Without further ado, Trish.
Thank you, Hope, very much. Wonderful introduction. And a huge thank you to the Morris County Hispanic American Chamber of Commerce for inviting me on behalf of Atlantic Health today, and our longstanding partnership with the Chamber and a commitment of excellence in ensuring we have a healthy business communities. So I'm incredibly proud to be president of Morristown Medical Center, as Hope had described, and also part of Atlantic Health. We're in 11 counties strong, and we have over a very passionate workforce of over 17,000 team members and 4,800 affiliated physicians. So to talk about our preparation, our observations during COVID, I've been asked to have a few comments on what we saw as a healthcare system during this pandemic and its impact, particularly on our very important community partners of our Hispanic and Latino community. Our #1 priority as a healthcare system is to always ensure safety and the well-being of our patients, our team members, as well as our community. Since early January, we have been planning for COVID-19 to make sure that our teams were well prepared to care for this increase in the pandemic. While we're always been able to care for our patients with infectious disease, this was none like any other pandemic or crisis that we've dealt with in the past. But what we learned, we had to quickly respond, adjust, and to care for our patients appropriately and delivering the best care that we could to our community, to our COVID patients and our non-COVID patients. So fortunately at Atlantic Health, we had the available space, medical expertise, and also resources to isolate our suspected COVID patients upon arrival. We also had dedicated COVID units to care for these patients and dedicated clinical teams to care for all. We started seeing the influx of patients about in the beginning of March. Boy, that seems like a long time ago now. But what we did not expect to see was a disproportionate impact on our Hispanic and Latino community. Similar to other ethnic groups, our Hispanic and Latinos with chronic disease medical conditions, such as diabetes, heart disease, and obesity, generally had more of a higher risk of COVID and a more severe disease of COVID. Generally speaking, our Hispanic and Latino community had a higher risk to our intensive care units as well. On an average, our hospitalized patients were also younger than non-Hispanic and Latino patients. So how do we respond and communicate? In order to adequately respond to treating our patients, we knew that our public responsibility was to be a trusted source of information and a timely trusted source of information. As the COVID landscape continued to rapidly change throughout the state and the number of patients rapidly continue to grow, particularly in our county, we knew that timely communication was critically important. We also recognized early on that having COVID information available in both English and Spanish language would absolutely critically be part of life-saving efforts in educating our communities. We were also able to facilitate innovative ways to inform and educate the community on a larger scale. And that was scaled by focusing on webinars and social media, which I'll speak to in a minute. We were also recognized the increase in COVID-19 cases among our Hispanic and Latino communities. All of our patient information materials were focused on Spanish and on English. Atlantic Health also created 2 Spanish public health service announcements, which were so important to educate. We also partnered with Mayor Doherty and other members of our community and our counties and in our regions to share those public service announcements with our community partners on also many different social media platforms. We also created a Spanish internet landing page, which we housed all of our pertinent COVID communications in Spanish, so people had ease of access to understand about this disease, learn what they needed to do for themselves as well as for their families. So in addition, we also knew that accessibility to testing was also critical and continues to be critical. Atlantic Health was one of the first in the region to set up a COVID-19 testing site and conducts thousands of tests in a given time period for our communities. We also partnershipped with the Morris County Office of Emergency Management and setting up a testing site at Morris County Community College. In just a matter of days, we established COVID-19 hotline, which supported our English and Spanish-speaking community members. We were able to help triage the questions that they had and get them to the right care as quickly as possible. Atlantic Health managed over 10,000 phone calls between providers and non-speaking patients, an increase of over 51% from 2019. Approximately 90% of those calls were definitely our Hispanic community. We also deployed our Spanish-speaking community health team to all of our major sites and all of our communities in need to make sure we gave information, shared resources, got patients to the physicians as quickly as possible when needed. Also finding behavioral health was so critical and continues to be a critical need in all of our communities. So making sure that linkage did occur in a timely fashion. So as part of this fast-moving pandemic, telehealth services began to boom in all of our communities, that we needed to treat patients in place, not having them come to major big facilities if they didn't need to. So in flattening the curve and a wonderful response to that. Digital care delivery began to boom, and also offering part of the digital care delivery translation services. Again, timely, efficient, quick communication to all of our community members. Inside our hospitals, we're also able to deploy over 1,500 tablets to our patients of COVID who were sitting in the beds, needing that communication with their loved ones who were sitting at home, concerned about them, and making sure they had hour-by-hour communication as needed. And also assessing the communication with our physicians and our patients in an hourly and a timely basis. We also had a significant increase in telehealth utilization. In fact, at the month of April, it was a 90% increase that all of our Atlantic Health physician and provider visits were virtual in nature. So what can you do to help now and in the future? There are many things we in the community can do to continue to decrease the impact of this terrible pandemic. A few of them are including, and I know you all know them, but just a reminder, wearing our face masks all the time, practice social distancing, and also when you're in large groups, and hopefully not in large gatherings, but when you're in need and have to be in a large gathering, please make sure you social distance, please wear your mask, and also wash your hands frequently. One major thing we definitely saw throughout this pandemic that people really delayed their care. They were concerned and scared to go to a physician office or go to the hospital. I need to remind everyone that hospitals and physicians' offices are a safe place of care. Get to those physicians when you need to, pick up the phone. We need to make sure that we decrease this pandemic. And particularly if you have a chronic disease, management is so important to make sure that that chronic disease is controlled, that you are supported in any way possible. Remember, go for your regular tests, go for your screening needs, and make sure that they are done in a timely fashion. So now's also a good time for all of us to look inward. How are we caring for ourselves? That we need to make sure our lifestyle is positive, looking at our diet, looking at how we exercise and how we care for each other. You know, when crises arrive, we need to look to the right and to the left and how we support each other as a community, as a business community as well too. So at this point, I'd like to turn it back to Christine. Thank you very much for giving me the opportunity to speak to you today. Thank you all and stay healthy.
Thank you, Trish. I now have the pleasure of introducing today's moderator, and event chair, Christina Martinez. Christina is a visionary and a trusted advisor, passionate about life and empowering others to achieve higher altitudes of success. Raised by a strong Mexican mom who later became a US citizen, Christina learned at a young age the power of using her multilingual skills to be a voice for others. She is president and CEO of Rising Above LLC, which helps clients strengthen organizational culture by building trust, leadership strategies, and productivity tools to boost engagement and bring greater harmony. Inspired by her journey in overcoming multiple life challenges and having competed in 6 marathons, that's right, 6 marathons and several triathlons, she joyfully explores the minds of the human potential and thrives on organic and holistic living. She is the Director of Membership and Marketing and past chair of the Morris County Hispanic Chamber of Commerce. She's a dear personal friend and a longtime friend of the Chamber. She's hardworking and an incredible person and leader. Christina.
Thank you, Hope, for that wonderful introduction, and I'm honored to be here and serve you all today. And thank you for the speakers. So I now have the opportunity to introduce you to additional panelists. You've already heard from Regina Hayward and Trish O'Keefe. And now I want to just give you a brief intro on the other panelists that will be joining us today. Let me tell you about Senator Bucco. Senator Anthony Bucco is a lifelong resident of Morris County, and he has served in the New Jersey legislature since 2010. His legislative accomplishments include sponsoring legislation to support Main Street businesses and encouraging New Jersey banks to lend to small businesses. He is a founding member of Daytop Drug and Alcohol Center and served on the Governor's Council on Alcoholism and Drug Abuse for over a decade. Senator Bucco has been a commissioner of Local Crime Stoppers program for over 2 decades and has served as a member of the Municipal Volunteer Fire Department since 1980. Thank you for joining us, Senator Bucco.
Thank you.
I will also, and please, I'll ask that you keep your camera on while I introduce the rest of the panelists, and the same for Regina and Trish, since you've already spoken, and then we will continue to the question. Next, I would like to introduce to you Dr. Diana Contreras. Dr. Contreras is dedicated to improving women's health care in her dual role as chairman of obstetrics, gynecology, and women's health at both Morristown Medical Center and Atlantic Health System. As a former associate chief of obstetrics and gynecology at NYU Lutheran Medical Center, Dr. Contreras launched a successful robotic surgery program and established new guidelines for quality and safety measures. She has served in progressive positions at Northwell Health's Long Island Jewish Medical Center, where she was medical director of the hospital's ambulatory surgical suite. A cancer specialist at heart, Dr. Contreras started her career as a oncologist at Texas Tech Medical in Lubbock, Texas. Welcome, Dr. Contreras. We next have Miguel Centeno. Miguel is Vice President of Community Engagement and Healthfirst Foundation for Healthfirst, the largest not-for-profit health insurer in New York. Prior to joining Healthfirst, he managed community relations nationally for Aetna and has held various positions with local and federal governments. He has extensive experience in how organizations can effectively meet the needs of diverse communities. Thank you, Miguel. You've also been a wonderful supporter of our chamber. Thank you. We also have Dr. Ricardo Reyes. Dr. Reyes is a podiatrist and foot surgeon in private practice. He's in North Gables Foot Clinic in Florida, and his main practice area is diabetic wound care. He is also a director of a wound care center in Miami. That's Dr. Reyes. And Dr. Reyes, if you could briefly turn on your camera, that would be great. We also have Ruben Taborda. Ruben is a strategic customer group hospital and distributor supply chain solutions for Johnson & Johnson. He also serves on the Morris County Hispanic American Chamber of Commerce Corporate Advisory Council as a member. Through a unique partnership with the United States Hispanic Chamber of Commerce, Johnson & Johnson employee resource groups, and overall diversity and inclusion teams, Johnson & Johnson was welcomed into the $1 Billion Roundtable in 2010. Notably, this achievement was recognized in Washington, D.C. by the Department of Health and Human Services as a beacon of excellence in local job creation across diverse communities. Entry into the $1 Billion Roundtable was not duplicated by another healthcare manufacturer until 10 years later. Welcome, Ruben. And if you would please also turn your camera on. You'll also later be hearing from others, but I don't want to steal their thunder. I will now take this moment to ask questions of the panelists. I ask that you panelists please also unmute yourselves as we will be heading into the section of the questions. Okay, the first question I'm going to direct to you, Senator Bucco. COVID has brought dire economic repercussions to New Jersey, especially small business owners, as they struggle to keep their businesses afloat. These stressors affect people's health. What has your office done to support our Latino community during this time?
Thank you, Christina. In the very beginning of this pandemic, I recognized early on that the small business community especially the Latino community, would be hit disproportionately harder as a result of the pandemic and the shutdown of our economy. As a result of that, I asked the Morris County Chamber of Commerce, in collaboration with the Morris County Hispanic American Chamber of Commerce, to form a panel, which we looked at ways in order to get the small business communities and our economy back up and running again. This includes the restaurant industry, the hospitality industry, many of those industries that are represented by the Latino community. And we developed, as a result of that panel, a scientific risk-based factor of reopening our economy safely. And I'm proud to report that many of the small businesses along our main streets, I think as a result of that report, the governor decided to begin to reopen those businesses as a result of that. Because let's face it, the best way to support our Latino community and to support our community in general is to get people back to work, and that's important. I was also the proud sponsor of the legislation that opened up the New Jersey Economic Development Authority to receive CARES Act funding to be able to supply grants to our minority businesses and small businesses across the state. I've continued to encourage the governor to fund the Economic Development Authority with the CARES Act money in order to supply the support necessary to keep our minority businesses and small businesses operating and keep them from actually closing their doors forever. We're at a critical point now in this fight, because we see many restaurants now without the ability to provide indoor dining, deciding to shut their doors forever. And to me, that's unacceptable. I think we need to continue to work cooperatively to make sure that the restaurant and hospitality industry especially has the resources necessary to remain open and to employ the 350,000 people that are currently unemployed as a result of this pandemic in that particular industry.
Thank you, Senator Bucco. The next question will go to Dr. Diana Contreras. Dr. Contreras, Trish earlier talked about the insights that you're seeing and what you've learned. I'm curious, in supporting women's health during this pandemic, what unique insights did you see in the Latino and Hispanic women?
Well, Cristina, muchas gracias de invitarme, de hablar sobre todo esto. It was quite an amazing honor to really practice medicine and take care of patients during this time. And Trish is absolutely correct. Morristown really rose to the occasion. We stepped forward and recognized that there may be unique opportunities for our Latino community, and with that we had to protect our Latina pregnant mothers especially. There was so little known at the time as to what to do. We really had very little information. And very quickly here at Morristown, we embraced the situation and very quickly decided that we had to move in a digital direction for our pregnant patients. We moved ahead and supplied some of the women who could not afford blood pressure cuffs so that we could monitor them from home, and really embraced our community in a tremendous way. What we've done is recognize that going forward, we have to be prepared should this happen again to us in the fall. So we've put in a much more robust digital system. We've addressed many of these things for our Latina community. We recognize that some of the systems that were out there by having people wait in their cars may not work for us, and therefore had to create a different kind of environment that has worked very successfully. I'm very proud to say that all the patients who came to us who were sick with COVID, the Latinas and others, we were able to support them very well and went home in great shape with their babies, or went home still pregnant as what was needed. And so we know that we were successful at what we were doing, and we are robustly putting in more processes so that we can safely take care of everyone, but really understanding the Latina community here in Morristown so that we can make sure they're well cared for in the future.
Muchas gracias, Dr. Contreras, for that wonderful work. And I have to say that when I saw Texas, I thought, I think I recognize that. Texas is my home too. Well, now New Jersey is, but thank you very much for that. Miguel Centeno. You have been, I've had the pleasure of knowing you for many years and have watched your career throughout time. And now you are heading the Healthfirst Foundation. And I'm curious, during this time, what has been the voice of the community during these challenging COVID times? And as an insurer and a nonprofit organization, how have you served that community?
Thank you very much, Christina. It's a pleasure to join you all today for another very important session that the Morris County Hispanic Chamber is conducting. So community-based organizations have been a critical voice for the Latino community both before and during the pandemic. So organizations like the Morris County Hispanic Chamber have tremendous credibility with the community, well-deserved and well-earned. And so partnering with them provides an avenue both for hearing community concerns and for providing needed resources, right? And so that these partnerships are an essential component of how Healthfirst engages with diverse communities, including the Latino community.
Thank you, Miguel. I appreciate your support. I now like to direct a question to another physician who's here in private practice. We're honored to have you, Dr. Ricardo Reyes. And as we mentioned, Dr. Ricardo Reyes is a podiatric surgeon. Also, you run a diabetic wound care center. And I'm curious, as a physician based in Florida, what trends are you seeing related to COVID and your private practice?
Good morning, and thank you very much for having me. It's an actual honor to participate in this symposium, and I think it's a needed service. My population in Miami is basically 99% Hispanic, more new arrivals, so most of my patients actually speak Spanish as a first language. So the challenge that we've had in what I do, which is wound care and dealing with patients that already have a fairly high morbidity when it comes to the COVID, is that a lot of the information doesn't really trickle down to these folks. There's a very big disconnect in terms of what's available for them and what can be done for them. And obviously there is a challenge. We have tried to implement a lot of telemedicine through our wound care center in our hospital. But once again, I mean, there's certain limitations with virtual medicine because obviously I have to do surgical debridements, we have to do management, things like that. So what we've been able to do in our community and in our practice is basically implement other services from durable medical equipment to infusion services that can work off of our telemedicine for these patients and obviously do it in Spanish. So it's been able to, that way we've been able to actually provide the services that need to be done at home for them if they're at risk. We go into the outpatient-based hospital basis or anything like that. And it's been challenging, but it's worked out very well. But Miami and the population we deal with is very much isolated sometimes from what's available to the general population. These are basically your service workers, your Instacart workers, your Amazon drivers. They are the workforce that keeps us safe at home, and a lot of times they're very neglected. So that's basically the impact. I've switched my practice probably to more than half of it to virtual medicine.
Thank you for the care that you're doing for our community. It's certainly much needed, and I know how tough it can be just when you're speaking Spanish and needing to get the resources. Thank you, Dr. Ricardo. Ruben Taborda, you are on the manufacturing end. So would you please share with us, as a manufacturer, what has Johnson & Johnson done to reach out and engage with the Latino community?
Gracias, Cristina. First of all, I'll give you two perspectives on what we're doing as manufacturers. By far, on the manufacturer side, the number one thing we're doing is working on a vaccine. Our pharmaceutical division this is priority one. Now there's a lot of great candidates out there. We're one of probably the top 4 in vaccine development correctly right now. Our vaccine has just started human clinical trials, and the results have been absolutely fantastic. We're not cutting any corners through the assistance of the US government and a lot of sharing with professionals in this area, including China when they first put the gene sequencing up on a public website. There's been a lot of collaboration in there. So hopefully we'll be the one manufacturer that will have a 1-dose application, because most of the other vaccines will be 2 doses. And that's going to be a big benefit from a compliance standpoint. So that's more on the clinical side. From the manufacturing side, and I'll give you a perspective from a procurement perspective, we continue to really provide opportunities for small and medium-sized businesses. You know, roughly, when you look at our U.S. spend, about almost 30%, 25% of our spend goes to small and medium-sized businesses. And that's not easy to do when you're trying to consolidate as a procurement science. But very proud to say that we were the first ones on the $1 billion roundtable. We're nearing $2 billion now after 10 years of getting inducted. The goal is to continue to provide local job creation. That opens up healthcare, that opens up educational access to a lot of students, and it just makes local economies better. And then the other perspective is I'm on the board of the board of directors on Hunterton Health, and I'm also on the board of directors of the National YMCA. And when you start to take up perspectives of what a manufacturer is doing with companies like those, is to partner with our local employee resource groups. How do we, because we roughly do 400 events on healthcare event. We could partner with those organizations and figure out how do we connect with communities, not just J&J, but Merck, AstraZeneca, all these other companies that sell into a hospital or that can partner with the National YMCA from a diabetes perspective. And that's what we've started, and we look to expand going into the future, particularly in a period of COVID.
Thank you, Ruben, for that insight. Regina, if you are there and can turn on your camera, I have a question from a financial health perspective.
I am here and will ask the host to give my camera access, please.
Let's see if that worked. Thank you very much. I apologize, not sure how that happened. You're here, first of all, thank you again for your support. As this is a health symposium, we talk about financial health and the importance of how that impacts physical health. So you're in also supply chain, and I'd like to know what have been the major disruptors you have seen in the supply chain, and how have they most impacted the financial health of Hispanic and Latino business owners? We need to unmute you.
Okay. When I think about the situation that happened in 2020, it certainly was one that no one had planned for. And so what was most important on the Wells Fargo side is that we took time to really understand what the pressing needs were, and that we responded in a way that would ensure that the best information was delivered to small, diverse businesses, and then particularly within the Hispanic community. We worked within our partner network with organizations like USHCC and the Stanford program, the Latino Business Action Network, with folks like the Latino Coalition, to basically plan out opportunities to share Paycheck Protection Program information across our networks, as well as we asked ourselves, what ways can we quickly deploy capital throughout our network in a way that would be helpful for those who needed technical assistance around that PPP program. As a result, we were able to touch over 30,000 businesses within weeks following COVID, when most cities and states began to severely restrict movement. We also, as I mentioned earlier, were able to create an Open for Business fund through our Wells Fargo Foundation, where we've committed to donate over $400 million of our PPP fees to small business organizations, nonprofits that help small businesses to recover and to restore. I think the key here is that we are acknowledging that this is an unprecedented situation from an economy perspective. There's a lot of data about the amount of stimulus that has been placed within the economy and how it already exceeds the amount from the 2008-2009 financial crisis. So the recognition that we're going to have to continue to sow into the economy from a long-term perspective is very, very key. I'm also excited that in the midst of this pandemic, we have partnered with Stanford to launch another cohort to help Latino-owned businesses grow and scale. And so that's been running in parallel with the situation that we have underway, which I think is an indication of the strong commitment that we have at Wells Fargo, over 1.3 billion being spent year over year with diverse businesses, and just continuing to see that as a path forward and a way back to recovery for the economy.
Thank you, Regina, for your support. And I know I see a lot of heads nodding, and I'm seeing, you know, the light bulbs going off and the opportunities for us to really engage at a higher level with one another. I appreciate that. I think as I think ahead, perhaps some of our participants will want, if we can, provide a link for more information on that Stanford program. I'm just thinking out loud here. Trish, as you shared, right, there are a lot of things that are happening at Atlantic Health System. And I'll say that one of the things that I'm most proud of is that you, being a nurse, right, that you also understand that frontline approach and having come from that and served those needs. So you shared, you know, what you've seen in the impact to the Latino community. Your nurses, tell me what you've seen with your nurses and the support you've provided.
Yeah, I am just extremely proud to be a nurse, and the resiliency that has shown from our nursing staff, our medical staff, and our support staff is bar none. It's probably our proudest moment. But I believe in setting the tone, as you do need to as leaders, we started with the discussion that this is not going to be a sprint, that this will be a marathon, as we had learned from other parts of the country. And how do we consistently support our frontline team, whether it's through basic needs, and thankfully for all the wonderful support from our communities, in ensuring that our staff are well fed, are supported, and wonderful donations across the board. And I know many of our systems across the state have received that. But it's just a very, very proud moment to see how all of our staff cared for all of our communities, and just so proud. I can go on for a couple of hours about that, but thank you. Thanks for giving me the opportunity.
Thank you very much. And I'm going to continue here, just circle through back to you, Senator Bucco. Many essential workers, as we've heard today, are Latinos. Tell me a little bit more about how the state is advocating them to ensure that their health needs are being met. For example, we're finding many of them may not have insurance, or they may not have paid time off, and they're afraid that if they contract, COVID, how are they going to put food on the table? And they may fear losing their job. So tell me a little bit about how New Jersey has supported that.
Thank you. Well, first, let me say this, that people who think they may be sick shouldn't go to work. Excuse me. They should get tested and they should be treated. And I think, as Trish O'Keefe has rightfully said, that our hospitals and doctors' offices are safe places to go to get the treatment that people may think they need. So I think that that's a big message that we have to send out to the community, that if you are sick, you need to stay home. We don't want you out there transmitting this disease to any of your coworkers or people in the community, and you need to get tested. So, and there are places in the county and in the state to get that done. The state's COVID-19 information hub has a list of resources for people who don't have insurance, including undocumented residents. You can go to covid19.nj.gov. That's covid19.nj.gov, and type "don't have insurance" into the search box, and you can that will direct you to services if you don't have insurance. But other information is available there as well. In addition to our hospitals and doctors' offices. We have the federally qualified health centers that are available to help those that can't afford treatment or don't have insurance. In Dover, for example, we have the Zufall Clinic, which I have been a big supporter of and have helped establish many programs there for the Latino community and for those that that we need to serve. I would encourage anybody that feels like they need treatment or they feel sick to visit either their doctor's office, hospital, or the Zufall Clinic in Dover. Their doors are open and there are great folks there that can provide the help that they need. Or they can even contact my legislative office. In the early part of the pandemic, I had a couple of those folks that didn't know where to turn as a result of not having insurance and not being able to find a doctor to get into. And we directed them to the proper locations, and those folks were treated and are back in the community now and doing their part again. So it's important to understand that there are resources available at the state level if you go to that site I gave you before, but also if someone is concerned and can't find that site, they can call my legislative office at 973-627-9700. That's 973-627-9700. In terms of the unemployment, we've been able to clear over 1,200 problem unemployment claims during this pandemic alone. Or I have a staff of 3 that's all they do all day long is work on clearing these claims. So if you do have a problem, you do lose your job, you need to get that insurance, and you're having problems, call my office and we'll be happy to try to help you navigate through that process. Thank you.
Thank you, Senator Bucco. We appreciate your support. And for those of you that are watching us, if you look at the chat box, we have posted the website that Senator Bucco mentioned, as well as the phone number. And I will say that his office is very responsive. So thank you for offering to be that support. Dr. Contreras, regresamos con usted. We've talked a lot about how telemedicine really is changing the way that we're now practicing medicine. How has it changed for you, the way that you're engaging with patients? What are the barriers that you're finding in shifting to virtual appointments, and how have you overcome those barriers?
So that's a great question, because, you know, when we first started this, it became a question of how we were going to be in touch with patients. And fortunately, the regulations were loosened so that we were able to do all kinds of ways of speaking with patients. And for some, it was just speaking, and for others, it was a video. But we know that having a video visit is a far better way of doing it. So what we have done is taken these last few months as things are quieter and really trying to build the resources that we have in place and put the right things in place so that we can have video visits with all the patients and really be able to monitor people in a really in a very much more technologically advanced way. Fortunately, we are on Epic through the Atlantic Health System, so our entire hospital system is connected and connected through many of our physicians. And what we're able to do is, at the safety of patients' homes, we can connect in some of this information. So we're in the process of developing really great systems to have this happen. Our biggest concern was, do people have a phone or a smartphone for which they can then connect? That was the biggest concern we had, because if people didn't have a phone with the ability to answer, that was really the big question. But fortunately, people had either somebody or one themselves that we could reach out to them. So I think that was probably the biggest challenge we faced, how to connect to each individual. We're in the process of building systems where we can have the translator be right in the middle of the whole process so that we don't have the disruption of a translator, but really make it streamlined so that we can connect right away. We feel it's critical to establish that relationship right up front, and language and technology should not be the problem. We think it's really important to try to do as close as we can for inpatient visits in-person visits to the same way we could do video. There are always going to be times where patients need to be seen in person. We recognize that. That's very important. For the person who needs to be seen through telemedicine, we need to do the best that we can. And we're really developing that and really have built the capacity to do that. So very exciting times and even more exciting going ahead. So really wanting to make sure that we're connected with everybody who needs and wants us.
Thank you, Dr. Contreras. Me llena el corazón saber que están haciendo eso. It fills my heart that you're doing that.
Pues muchas gracias. Much appreciated. We'll move on. We'll go forward. I promise.
Yes.
We will take care of the Latina community.
Así es. I am just watching my screen, and now I want to direct our symposium to introducing Christina Field. Christina Field will shortly bring on the United States Surgeon General. Christina Field is a senior fashion designer in New York City for the children's clothing company Pink Chicken New York, where she has worked for almost a decade. She caught the fashion bug early, playing dress up with her stylish and well-traveled Colombian abuelita, and attended the Parsons School of Design. Christina grew up with the Morris County Hispanic American Chamber of Commerce, being the daughter of the Chamber's founder, Esperanza Porras Field. She has designed and handmade 4 runway collections over the years for the Chamber's Business Expo and fashion shows, and she's amazing. As an accomplished runner, Christina has completed 8 marathons and counting. She is a creative force and a great athlete and a dear friend, and it is my honor to introduce you to Christina Field.
Thank you so much, Christina. You are my fellow runner, a great friend, and the icing on the cake is that we have the same name.
Thank you.
I'm honored to present our guest speaker, Vice Admiral Jerome M. Adams, this morning. It's also fitting for me to be the one to introduce him for 2 reasons. The first is that he went to college with my close friend of 14 years, Maury Clem Richardson. They attended the University of Maryland, Baltimore County together and were neighbors in their junior year. So it's a nice connection that we have. The second reason is that as a fashion designer, I've admired the Surgeon General's due diligence of not only advocating for the importance of wearing face masks, but also offering tips on how to make face coverings at home with household items. He shared a video of making a face covering out of an old t-shirt and rubber bands. That really impressed me, and a quote that has stood out for me that Dr. Adams said about face coverings is, "Consider them a fashion accessory and consider it like your underwear. Change it every day, wash it every day." He's absolutely right, and I never thought that I'd be getting fashion advice from the Surgeon General. Masks have become part of everyday life now, and being able to accessorize your face mask with your outfit can make it fun and motivate people to wear them. So I applaud Dr. Adams for being so creative and being such an important voice during this scary and uncertain time. Vice Admiral Jerome M. Adams has a very impressive resume. So before I introduce him, I would like to tell you a little bit about his background. He is the 20th Surgeon General of the United States. His mission as the nation's doctor is to advocate the health of the American people, and his motto is better health through better partnerships with the public health community and forging new partnerships in other sectors. He has a bachelor's degree in biochemistry and psychology from the University of Maryland, Baltimore County, a master's of public health degree from the University of California at Berkeley, a medical degree from Indiana University School of Medicine, and is a board-certified anesthesiologist. He previously served as the Indiana State Health Commissioner from 2014 to 2017, where he led the state's responses to Ebola, Zika, and the largest HIV outbreak in the United States related to injection drug use. He is a member of the President's Coronavirus Task Force, and earlier this year, he released Smoking Cessation, a report of the Surgeon General, the 34th report on tobacco and the first report on cessation in 30 years. As Surgeon General, he oversees the operations of the U.S. Public Health Service Commissioned Corps, which has more than 6,000 uniformed health officers who serve to promote, protect, and advance the health and safety of our nation. Dr. Adams has pledged to lead with science and facilitate locally led solutions to the nation's most difficult health problems. He also feels his toughest but most important job is being a father to 2 teenage boys, Caden and Eli, daughter Millie, and dog Bella. So without further ado, please welcome Vice Admiral Jerome M. Adams, the 20th Surgeon General of the United States.
Well, good morning. Buenos dias. Una mascara. I so appreciate you talking about these as a fashion statement. I'm going to remove mine now, but I wanted to start off by modeling good behavior. Thank you so much, Ms. Field, Christina, for the kind introduction. I really appreciate the opportunity to join you all today and update you on progress in COVID-19 and the important work that I think we all can do together. I want to mention again, that you're a friend of one of my good friends who was texting me last night and asking about stories from college that so we're not going to go there today. Because, we want this to stay at a high level, but I do want to say that the friendships that we have, the people that we know, they're really what gets us through difficult times like the one we're in right now. And so one of the things I would encourage all of you to do is to reach out to a friend, whether it's by text or FaceTime or phone call. Let them know that you're thinking about them, because one of the hidden, I think, impacts of COVID are the mental health impacts. The fact that everything that we tell people to do to combat anxiety or depression or to lower your risk of suicide are the exact opposite of what we tell you to do to keep yourself safe from COVID in terms of social distancing. So reach out to a friend today. And I want to thank all of you for your efforts to prepare for and to protect your communities against the COVID-19 pandemic. It goes without saying that these are truly unprecedented times. This pandemic has hit everyone across the globe hard, but especially people of color and those who are older. The reasons are many, and they're rooted in both medical and social pre-existing conditions that conspire to reduce our resilience, our opportunity, and our health. Just a mention of COVID-19 may make many of us immediately think of healthcare. And healthcare is important, but as critical as healthcare is, we know that health actually begins at home, in communities that are designed to provide income and financial security, education, access to transportation, safe places to be active and healthy, affordable food and housing. And importantly, all of these things must be free of structural and institutional barriers related to race and to bias and to ethnicity. These social determinants contribute to medical determinants. Chronic diseases such as diabetes, cardiovascular disease, high blood pressure, and we know these diseases are especially common in people of color. And that is why, in many cases, we're seeing this combined impact of medical pre-existing conditions and social pre-existing conditions, resulting in terrible disparities as it relates to COVID. American Indians and Alaska Natives and African Americans have been hospitalized at 5 times the rate of whites. Hospitalization rates are 4.5 times higher for Hispanics compared to whites. We know that here in Washington, D.C., where I'm sitting right now, and I look out my window at the Capitol, that in some communities, up to 50% of Hispanic children have been exposed to the coronavirus. And there was an article I was reading in the paper that just this morning talking about how Hispanic women in particular who are pregnant have been exposed to COVID at much higher rates than other pregnant women. And again, we already know many of the reasons for these disparate outcomes. We didn't need COVID to tell us that we have disparities. COVID just really shone a light on them in a way that we haven't had occur across the country and across the planet in my lifetime. For instance, we know social distancing and teleworking are critical to preventing the spread of coronavirus, yet only 1 in 5 African Americans and 1 in 6 Hispanics has a job that allows them to work from home. We know that people of color are more likely to live in densely packed urban areas and in multi-generational homes. Why does that matter? Well, if we tell you to quarantine because you've been exposed to someone with COVID, or we tell you to to isolate because you've been diagnosed with COVID, but we don't take the next step and ask you about your living situation and send you home to a house where there are maybe 6, 8, 10 people living together and sharing a restroom, then we're setting you up to fail. We also know people of color are more likely to use public transportation, where again, there's frequently touched surfaces and a greater propensity for being closer than 6 feet to one another. And these factors all conspire to create greater risk for spread of a highly contagious disease like COVID-19. We know that case rates are high and that they're rising in many places across the country, but it's important to note that other places are beginning to see a plateau. I sent out a tweet just this morning highlighting the good and the bad. For instance, we know that cases are declining on average across the country, and positivity rates are at the lowest they've been all summer, down to 6.2%. And I know we don't have all epidemiologists or medical experts here. We tend to think of states and municipalities as being in green, yellow, and red areas. If you're green, you have a positivity rate less than 5%. If you're a yellow, then you have a positivity rate between 5 and 10%. If you're greater than 10% positivity, we consider you to be in a red zone. So when you hear people talking about positivity rates or red, yellow, green, that's what we mean. And we've deployed teams to assist in surge testing and to identify and execute strategies to combat the spread in those yellow and in those red zones. We're making progress in structures, processes, and knowledge needed to fight the pandemic. Again, it can both be true, and people want to present you with these binary all or none, black or white, good or bad options. But the reality is we still have challenges. The death rate actually went up by about 2% over the last 7 days. And that's reflective of what was going on 4 to 5 weeks ago. So again, talking about timelines, we know that what you do today is what's going to determine the cases in about 2 weeks, and the hospitalizations in 3 to 4 weeks, and the deaths in 5 to 6 weeks. So deaths going up, but again, cases and positivity rates coming down. We also know the US has conducted over 70 million tests with approximately 9% or 6 million tests returning positive overall. And again, the positivity rate that I got back this morning for the past 7 days is down to about 6.2%. And I want you to know this happened in part to opening of more than 500 community-based testing sites with the support of private sector partners, some of you all involved in this meeting today, and the US Public Health Service Commission Corps, which I help lead. And I want to thank those of you who've been involved in these sites, because through your instruction and through your input, 70% of these sites have been located in socially vulnerable areas as categorized by housing situations, race, ethnicity, income, and language barriers. We also fund testing at 94% of America's community health centers, which predominantly serve low-income areas and communities of color. So if you don't know about community health centers, I would encourage you to find out more about them and to help people understand that they're all over the country, in rural and in urban areas, providing services to the very people who were most impacted by COVID-19. We recently allocated about $15 billion to Medicaid providers and $10 billion to safety net hospitals, which are sources of care for our most vulnerable. And beyond the testing work, CDC now requires that all testing data reported by states include income on race, ethnicity, and zip code. And that's important to me as a public health official, because it allows us to better understand how to protect our most vulnerable communities. One of the challenges we've had throughout this pandemic and well before it was that, again, we didn't have a clear visibility at the federal level on who was being impacted. We had to go on our hunches. And I've been doing this for over 20 years. My hunches and my experience told me that people of color were going to be disproportionately hit by COVID. And it's why I've been talking to Latino and Hispanic organizations and African-American organizations, and to Native American and Alaska Native organizations going way back to February. But people now are starting to have the data to be able to say definitively these communities are being hit particularly hard. HHS has supported language assistance for those with limited English proficiency. For example, COVID-19 materials are now available in Spanish, coronavirus.gov. If you go to that website, that's our website. That's everything, one-stop shop for all information you need, available in Spanish. And in addition, the Office of Civil Rights at HHS issued a bulletin on ensuring the rights of persons with limited English proficiency in healthcare settings. Our Office of Minority Health recently funded the National Infrastructure for Mitigating the Impact of COVID-19 within racial and ethnic minority communities, a $40 million cooperative agreement that supports information dissemination and linkages to care for racial and ethnic minority populations. And we've also deregulated telemedicine, making ongoing care for many medical conditions safe, accessible, and convenient for millions of patients and their healthcare professionals. And I mention that specifically for communities of color, because we know that, again, not everyone has the ability to just take off work and go visit a doctor, or not everyone has transportation to be able to go into their appointment. And especially during COVID, we know that it may not be safe for people to do some of these trips. So telemedicine is making it safer for the providers and for the patients. These investments are critical, but we're not stopping there. We've set a goal to reach 100 million completed tests each month by September of this year. And we've decreased the turnaround time on testing, which I know is a problem for many of you. Admiral Giroir, our testing czar, told me this morning that the commercial labs, which are the problems, are now down to just over 2 days turnaround on average. Again, that's on average. That's not to say that you're still not going to have reports of people being told that they have a 5 or 10 day turnaround, and that's unacceptable to me. I want you to hear me say that. That is unacceptable. A 10-day turnaround allows us to do almost nothing in terms of contact tracing and isolation, but the numbers are moving in the right direction. You also had approval, emergency use authorization this week of a saliva test that will make it easier for people to test at home. And this expanded testing, coupled with contact tracing and isolation, will help us check the spread of this virus and protect millions from harm. I mentioned contact tracing. I was actually in Fort Wayne, Indiana last week, and they told me one of the concerns that their Hispanic and Latinx communities have is in answering the phone for contact tracing. We need to do a better job, and I'm asking you to help me do this, of reassuring communities that you will not be asked about your documentation status when we're doing contact tracing. We will not use your treatment for COVID or you telling us where you've been against you and harm you. We understand at HHS, and I understand that being able to engage with communities protects not just the individual, but the entire community. I also want to mention remdesivir and steroids and tailored approaches to ventilation have improved recovery rates and returned more Americans safely home to their families. So hospitalizations are shorter and more people are going home now, even after being diagnosed with COVID. This administration's emphasis on public-private partnerships is allowing us to progress towards vaccines, therapeutics, and diagnostics at a record pace as part of Operation Warp Speed. During normal times, drug development involves a series of sequential steps, and that's why it can take years to develop a vaccine. Operation Warp Speed is unique, and some of these steps are being combined so that we can, again, get a vaccine that is safe and effective, but also get it in a record amount of time. And Tony Fauci has told me repeatedly that he still expects we'll have a vaccine available by the end of this year, beginning of next year. I want you to understand, since we talked about vaccines, that this is our most important flu season, perhaps in my entire lifetime. We need to make sure people are getting their flu shot so we don't have that double whammy of flu and COVID overwhelming our hospital systems. And we know that the symptoms of COVID are the same as symptoms of flu, so that can cause confusion and cause overwhelming of our testing capacity also. But then use the flu vaccine as a ramp up to making sure people will accept the COVID vaccine when it's available, because vaccine availability is just the first step. We need to ensure all Americans have an equitable opportunity to receive the vaccine, and that we're combating vaccine hesitancy, because what I don't want to happen, and this is a possibility, we can have a vaccine that is safe, effective, and available in record time, but it could actually increase disparities if the people who would most benefit from it are the people who either can't get it or most resistant to taking it. So again, asking all of you to ramp up your flu campaigns this year, both to lower flu transmission, but also to prime people for getting their COVID vaccines when they're available. Please continue your conversations with friends, families, and colleagues about why vaccines are important, whether for measles, flu, or for COVID-19. And while we're optimistic about a vaccine, I want to close by asking you to please remember that a vaccine will really help us put an end to this epidemic, but New York has a positivity rate less than 1% right now. Italy and Spain were among the hardest hit places in the world, along with New York City, and they're reopening schools, they're reopening places of worship, they're playing sports again, and they're doing it without a vaccine and without a miracle therapeutic. The best immediate defense against this infection are tried and true public health measures, things that your mother told you. And I want to close by talking about what I call the 3 W's. Again, 2 of these things your mother told you when you were a little kid. Number 1, wash your hands frequently and thoroughly. Number 2, watch your distance, or as your mother said, stay away from strangers. Now, what we mean when we say that is to keep at least 6 feet from others and avoid crowded indoor spaces. And the 3rd W is to wear a face mask to protect others. So again, wash your hands, watch your distance, wear a face covering. Why a face covering? Well, the high degree of asymptomatic spread makes wearing a face covering and physical distancing an imperative. Asymptomatic spread means that the people who are spreading it may look and feel fine. So the novel coronavirus is part of a family of viruses that include the common cold. If Christina and I were in a room and I had a cold, she would likely know it. I'd have runny nose, watery eyes, I'd be coughing and sneezing, a fever, I would look bad, and Christina would say, Dr. Adams, you don't look so well. Maybe you should go home and maybe I should stay away from you because I can't afford to get sick. And that is why in the beginning, we did not recommend masks, because we thought this virus would behave like the common cold and other coronaviruses that we dealt with. What we learned in March and April was that this novel coronavirus has a high degree. 50% or more of people can spread it asymptomatically, meaning they don't have symptoms, meaning that they don't know that they're sick, or you can't tell at them by looking at them that they're sick. And so that's why we recommend now that everyone wear a face covering. And we need to educate people as to the why, so that they understand this isn't just about protecting yourself. It's much more about protecting other people around you. While advances in testing and treatment are critical, the way we win this war against the virus is through individual behaviors. Simple, scientifically sound acts that have been proven to help get us back in control of COVID-19. So this is where I need your help. As trusted leaders in your communities, networks, and states, you were able to make a difference in how we navigate the reopening of businesses, schools, and communities, in many cases, better than I can as Surgeon General of the United States. So I ask that you continue to follow the protocols designed by public health experts and available at coronavirus.gov or at your State Department of Health website. This guidance is based on science and experience with the virus. And unfortunately, just as we're combating the virus, we're combating a pandemic of misinformation on social media and beyond. So we need you to send people to trusted resources. Again, coronavirus.gov is available in Spanish and in English. Implementing this guidance in your offices and homes will help you protect not just those you know and love, but your entire state, your entire country, the entire planet. Recently, I found that work my office has been leading for years before the pandemic has an added urgency and relevance now. And I just want to mention to you that we're putting out a call to action on hypertension or high blood pressure control. And we're also putting out a call to action on maternal health. Doing these things, I think, will help lower the chances that people have complications from COVID, but it will also put communities, particularly communities of color, in a more advantageous position to be able to respond to the virus and to be healthier long after we're done dealing with the virus. So while this pandemic's been an unprecedented challenge and we're still discovering new things each and every day, it's important to note that this virus is only 6 months old, but we've learned a lot in the last 6 months. We know who is most at risk and why. Again, older people, people with chronic medical conditions, and people of color. We know much more about how to treat those most severely affected. We know that we must address the underlying drivers of disparate outcomes, these social conditions that can limit or unleash a healthy future. We know what works to keep people in their community safe. And we've launched a messaging campaign called #COVIDStopsWithMe, where I talk about my 3 W's: wear a mask, wash your hands, and watch your distance. And if you're on social media or on your phone right now, I ask that you go to my Twitter handle @Surgeon_General and retweet out the 3 W's. And remember, COVID does stop with me. We all have a role to play in preventing the spread of this virus. I need your help in spreading the word that our health, our nation's future, our ability to reopen schools safely, our ability to get back to worship, our ability to get back to some sense of normal is actually in our hands. And we only have to do these things for just a few more months. We've got to get through flu season, December, January, when we get a vaccine. And if we can put up with these minor inconveniences of social distancing, of washing your hands, wearing a mask, and watching your distance, just through December, January, we can get to a vaccine, and then we can get back to a greater sense of normal. So get your flu vaccine this year. Donate plasma if you've tested positive for COVID-19 and recovered. You can find a plasma donation center on coronavirus.gov. And know that I believe firmly as Surgeon General of the United States that we have all the tools we need right now to suppress the virus, to save lives, and to get us through until we get a vaccine. And it doesn't mean that we have to shut down, but it does mean that the freedom of choice in a democracy, and Nick Saban, Coach Nick Saban of Alabama football said this yesterday when I was having a conversation with him. In a democracy, the freedom of choice comes with the responsibility to make decisions with integrity. We need to challenge everyone around us to make the decisions to wear a mask, to wash their hands and watch their distance. And I know that we will get through this once in a lifetime pandemic. And I hope we get through it with a better resolve to make our communities healthier, more resilient, and more just. So thank you. I appreciate the opportunity. And again, thank you, Christina, for that kind introduction. I hope you all have a wonderful meeting and know that I'm here for you. I'm here for your organizations. You can go to surgeongeneral.gov or at surgeon_general and follow me on Twitter. I'm always pushing out information that I would ask you to continue to push out about how our communities can stay healthy and be more resilient in the future.
Thank you, Dr. Adams. It has been a pleasure to have you here. And so you go from one Christina to another Christina. I'm watching the questions that are coming in, and there's a few that have come in, so I'd ask you if you would be amenable to giving some feedback on this. So one question that came through is, with schools opening up next month, do you feel that it's safe for our children to go back to school using safety protocols like wearing masks, etc.? What instructions should we give our children when they come home from school? Like, should they shower or change their clothing upon return? Should we take these extra steps, and any other precautions?
Great questions. And I want you all to know I have a 16, a 14, and a 10-year-old at home. So I'm not on TV or on social media telling you what you should do. I'm actually living it myself and having these conversations with my wife and my kids. I want you to understand there are real health harms to kids not having in-person school. And we've seen vaccinations fall behind, 4.2 million children behind on vaccinations. One of the things that I would speak about is our Catch Up to Get Ahead vaccination campaign, encouraging parents to make appointments with their healthcare providers to get vaccinated. We know that child abuse reporting is down 50% in Massachusetts and likely elsewhere where they aren't looking at these numbers, because we know a lot of that reporting occurs in schools. We know children out of school are more likely to misuse substances and to be obese. And we know all of these things disproportionately impact communities of color. So again, ironically, the kids who are most likely to be impacted by COVID in communities are also the ones most likely to be impacted by not having in-person school. My default and Tony Fauci's default is that we should do everything we can to get kids back to school, but to do it safely. It doesn't have to be a choice between being in school and being unsafe. We can do it safely. And the number one predictor of whether or not your kids can safely go to school actually has very little to do with what happens in the school. It has more to do with your background community transmission rates, because the best school opening plan in the world can fail if you've got high degree disease spread in your community. And the worst school opening plan in the world will be successful if you have little to no disease spreading in your community. So it goes back to the 3 W's, making sure everyone around you and in your community is taking these basic public health measures to lower the positivity rate and disease transmission. Now, you asked specifically about schools. I would tell you to go to coronavirus.gov, and there's great information about how you as family members can stay safe and keep your kids safe in schools. But when your kids come home from schools, I would recommend that you have them take off their clothing immediately, and that you have them wash their hands and arms thoroughly, or ideally to take a shower, because we know the disease spreads primarily by droplets. And someone around them could be talking, and those droplets could come out and land on their clothing, and the virus can live for several hours and sometimes several days on various surfaces. So I would recommend that you have them take off their clothes when they come in and wash at least their hands and arms thoroughly, but ideally hop in the shower and to make sure that they're leaving their book bags at the door or in the garage, not taking them all the way in and through the house to stop that surface transmission of disease, and making sure you impress upon them the importance of wearing their mask and not being around people who they shouldn't be. A lot of the schools are cohorting individuals and saying you should not be close to people in other classes, because if you do have someone with a positive case, you want to only have to keep 2 or 3 or 5 people home from school and not to have to shut down an entire grade. So those are some steps you can take. But again, for more steps on how to keep your kids safe, go to coronavirus.gov. And if you just scroll down, there's tips for safe school reopenings.
That's great. Thank you. And I want to mention to those that are watching us that we are posting this website information in the chat room. So it is there as well as the contact information, so that you can go visit those pages that the Surgeon General has suggested. There are some other questions that have come in, and if the panelists want to open up their cameras, are welcome to. I'm seeing that they are more directed to you, Surgeon General, so I'm going to ask that while they're here. And we're back to the college and schools and students. So another question that came in was that many Hispanic and college-bound students have had to put their education on hold to assist their families during COVID due to financial pressures. So Hispanics continue to be the lowest educated in the community, and for all of the strides that we're making, there's a concern that how is this going to set us back as a community for future leadership? So do you know if—
Oh, please finish.
Yes. Do you know if the number of Hispanics that have dropped out of high school or college are due to COVID? Are they higher than other groups, whites, blacks, Asians?
We do not have that data yet, but we are tracking that data, and that is something that I am concerned about. So I'll just tell you a quick story that's not directly related, but it makes the point. I was talking again with Nick Saban and the Alabama football team last night, and what these young men told me is that, hey, if I'm not in school, if I'm not playing football, I'm going to be home, and I'm going to be out and about in the neighborhood. And actually, it is safer for me to be on the football field with the protocols that they have than it is for me to be at home. One of the concerns I've always had as a person of color is that people of color are disproportionately living on the edge. And I worked 2 jobs all during medical school. While my white colleagues were in the library studying, I was at McDonald's and then in the lab working to be able to pay my way through school. And we know that that all of us are literally just a medical condition, a family catastrophe, or a pandemic away from having to drop out of school to leaving an opportunity that may be putting us ahead in order to take care of our families. So I'm very sensitive to that. And what I can say to you is we are and will track those numbers. And I think we need to continue to lift this up as an issue that goes into discussions about congressional bills, that goes into discussions about what states should be paying for. We need to support people so that they don't fall backwards for the sake of COVID, and then have lifelong issues related to what happened during a 1-year time frame when we were dealing with a pandemic.
Thank you for that response. I have another question that has come in that's a little more broad, and that is, what can we do as Latino professionals in the community to assist these kids? Are there programs, organizations out there that we can all tap into and trust that they're actually working to ensure the well-being of these children? And what I'm hearing is that it would be a great way for us to link within the audience and provide these tools so that they can walk away with immediate takeaways on who they can link to.
So this is a great one for the other panelists to jump in on, because I know they are aware of resources specifically in the community. But one thing I would reiterate is you can help, number one, by getting the facts yourself. You should go to coronavirus.gov at least once a week, and your State Department of Health website at least once a week, so you understand what's going on in your community, the trends, and so you understand what the most recent recommendations are, and then share that with your communities. And why do I say that? Because to some extent, no matter what I do as a government official, no matter what I do as someone who is not Hispanic or Latinx, it's only going to go so far. And so part of what I've been trying to do is engage with individuals such as the people on this in this meeting, and asking them to be surrogates, to be advocates in the community. It's why I partnered with Jose Andres and to get messages out about mask wearing. It's why we need to, why I asked you to help people understand the importance of getting their flu shots, because they may not hear it or want to do it if the Surgeon General says so. It's why it's important that you all understand what contact tracing is, and help people understand that no one's going to ask you about your documentation status when we're contact tracing. We're really just trying to keep your community safe. So you all being informed and then being advocates in the community to disseminate the information out there is important. And then you giving us feedback as government officials about what you're hearing in the field, so we can continue to adapt and adjust. So that documentation issue that I brought up, and issues about the public charge rule. These are things that I might not have known ordinarily, but in engagements and conversations with the Hispanic and Latinx communities, I was told these are concerns we need to address. And DHS actually put out a letter about the public charge rule, saying people will not be denied future services based on getting tested for COVID and getting treated for COVID. So important that you all work with us and be our advocates in the communities. But I'll throw it to the panel. Anyone from the panel have thoughts about that question?
Would like to share, you can unmute your microphone.
Well, thank you, General, for being with us today. The information that you provide is very helpful, I'm sure, not only to me as a state legislator, but to the panel and everybody listening. So I want to thank you for your time, spending it today with us. Your thoughts are very insightful. The state of New Jersey is beginning to look at different statistics, especially looking at statistics regarding the impact on demographics in hospitals of those that are impacted by the coronavirus, so we can better understand which communities. We know that communities of color are impacted disproportionately, but we can begin to track some of that stuff with the hospitals. I'm sure, Trish, you're familiar with this. The legislature just passed a bill that I supported that would set up this process. And it's quite possible that we need to do that in education as well, to make sure we know how the virus is impacting folks from an educational standpoint, both at the grade school and high school levels and in higher ed. So I think it's a great point, and we are moving in that direction. I'm not sure whether the Department of Education has started anything like that yet. I certainly haven't heard of it. I have been involved in the statistics gathering from the hospitals, and I think it's a great point.
Thank you for that, Senator Bucco. Before we sign off, Dr. Adams, I want to introduce you to our panel, and then I will turn it over to Ilka Padilla, who will close. We have, I imagine everyone sees something different here on the screen, but our first speaker was Trish O'Keefe. And let's see, there you are, Trish. Trish is the president of Morristown Medical Center and vice president of Atlantic Health System. And there you are.
Hi, Surgeon General. Thank you very much for participating as well.
Absolutely. Thank you. And one of the things that we're encouraging health systems to do is to track that data and to work with us so it can be reported out, because the data that we get at a federal level is only as good as the doctor or nurse or pharmacist or health tech inputs at the ground level. And so we need to build a system that better gives us real-time data so that public and state policy, we've got the senator on too, informed by real-time data Unfortunately, what we do in health, and this was long before COVID, is we try to drive the car by looking in the rearview mirror. And sometimes what we're seeing in the rearview mirror is years ago, and it's not what happened yesterday in our communities. So I want to thank you for being on the panel, and I just want to continue to encourage health systems to look at data reporting, but also to look at the social determinants of health and not just look at everything through a medical lens. Health isn't just doctors and nurses and clinics. It's what happens in communities. So I know you all are doing work in your health system to address the social determinants of health, but I just want to say to everyone out there, challenge your health systems and your doctors and your nurses to take that next step and to not just make the recommendation to stay at home, but to have the courage to ask the question, what's your home situation look like? Do you have the ability to actually comply with what I'm telling you to do? And then to take that third step and to say, if you don't, to be able to connect them with resources, many of which already exist in the community, like United Way, to get people support that they need so that they can be healthier and make healthier decisions.
Thank you. We also have Regina Hayward, who heads supply chain at Wells Fargo.
And Dr. Adams, yes, it's great.
So great to see you. One of the things
it is
working with Wells Fargo and other corporations on is my Community Health and Economic Prosperity Report, which we've been working on for 3 years, believe it or not, pre-COVID, but COVID showed how important this was, that corporations understand that the health of your bottom line, your shareholder value, actually, or your shareholder value depends on your investment in communities. And if your community is unhealthy, you're gonna have greater absenteeism, you're going to have less productivity. You're going to have runaway healthcare costs, which are the #2 expense for Fortune 500 companies. And I see Coca-Cola on the line right now. They can attest to that. But if we invest in healthy communities, including vaccinations, including addressing COVID, but including addressing maternal mortality and hypertension control and substance misuse that's going on in our communities, that it will help not just the individuals, but that it will help the corporations, and we will be more prosperous overall. When the least of us suffers or can't get the resources they need, eventually all of us suffer. So good to see you, Regina, and I look forward to continuing the work with you all, particularly as we roll out our Community Health and Economic Prosperity Report.
And thank you for being such a strong advocate. I've heard you on calls with the Hispanic community and the African American community, and you have really taken the mantle to get the information out. We appreciate it. Thank you.
And the one other thing that I want to say to you all in regards to that is, this is a once-in-a-century public health crisis. It'd be hard by itself, but there is no page on the pandemic playbook on an impeachment trial, on a presidential election, on a social justice movement, the likes of which we haven't seen in 50 years. This is truly a unique moment, and we all need to understand that politics in some ways are inextricably part of this, but we all need to do everything we can to pull politics out of it and say that health and opportunities for health should be nonpartisan. I want you all to understand, people like to say, if you read the headlines, they always say Trump's Surgeon General. I want you all to understand, I was appointed by the president and I'm thankful to him for that. I was confirmed by, which was bipartisan. I work for the American people. I work for you. And I want you all to understand that I'm going to continue to fight for you, regardless of politics or who you vote for. And I just call on you to really try to keep politics out of discussions about health where you can. I mean, the senator's on the line, and I do understand that politics affect policies, but we want our health policies to be nonpartisan. I'm not even say bipartisan, nonpartisan, because that's the way we move forward.
I couldn't agree more. And I think here in New Jersey, from the beginning of this pandemic, both sides of the aisle have worked hand in hand on a bipartisan basis to pass the legislation necessary to combat this pandemic. And we've done it swiftly, and it's had great results for our residents, but it has been done on a bipartisan basis. And, I've been the prime sponsor of a number of pieces of legislation with my colleagues from across the aisle that have made it to the governor's desk and been signed, no questions asked, and that's the way it should be.
Thank you. I want to continue with the introductions and then we're wrapping. I also want to mention that the comments are coming in that yes, we are all Americans first. So thank you, General, for saying that. Next, I want to introduce Dr. Diana Contreras, who is the Chair of Obstetrics and Gynecology and Women's Health for Morristown Medical Center and for Atlantic Health System. Doctora.
Dr. Adams, I want to thank you for bringing up the issue related to maternal morbidity and mortality, related especially for women who are Black and brown. I think it's a significant problem in the United States, and we have to be very realistic that this is an important topic, and I really appreciate you bringing this forward. It affects all women, and women of color are really more affected than others pre-COVID and during COVID and probably post-COVID. So thank you for bringing this forward, because it is something that I hope to continue working very hard with you and the rest of the government working on. We at Morristown have been, and the Atlantic Health System have been, real advocates of trying to change across the state of New Jersey how women are cared for. And so we very much appreciate the fact that you are an advocate of that. Thank you.
And I about jumped out of my seat when I saw that you were on the panel. Couldn't agree with you more. Before COVID, my big plan for this year was this was going to be the year of focusing on maternal health. Over 700 women die during pregnancy each year or around the time of pregnancy. They're disproportionately Black and brown. And while hundreds die, thousands across the country are disproportionately harmed. And the shocking part about this is that about 2/3, over 65% are actually preventable. And
Yes.
so we need people to come together. We need people to understand that many women have not gotten prenatal care because of fear of COVID. And so for our Black and brown communities, as terrible as the impact of COVID has been, the impact of the shutdown and the fear around COVID actually is going to have health harms that equal or far surpass the actual damage that we see today from COVID. And again, it's not to pit one versus the other. It's to say that's why it's important we safely reopen and do the things that we know will allow us to open sooner and more safely, so that we don't have these spillover impacts of the shutdown.
Yes, I agree. We're very proud. Yeah, thank you. We've done great work. We've really been very innovative and creative in making sure that our pregnant patients continue to have their care throughout all of this by using technology and really enrolling in digital programs and doing everything we could through the generosity of our hospital system to make sure that these women were well cared for. So I do believe it can be done. Happy to help you in any way I can. I'll reach out to you afterwards, and any way I can help to, this is a really important topic. Nothing more better than mom, babies, and apple pie. So it's really important that we support women and their newborns.
Thank you.
Thank you. We also have, since we're on physicians, Dr. Ricardo Reyes, who is a wound care surgeon, podiatric surgeon. Dr. Reyes.
Hi, thank you very much, Dr. Adams, for touching base on something that is dear to my heart. My entire practice is dedicated to limb salvage. And I think one of the issues you touched upon with the Hispanic population and the impact of COVID was that I think in many respects, it's already a sick population in the way that the rates for hypertension, diabetes, PAD, and things of that nature, it made them more susceptible to more complications. And for us in wound care, it's been particularly trying because obviously most of our procedures are either done outpatient, ambulatory. So we've had a good experience, by the way, with HHS and the way they've coordinated with private practitioners and centers. And one of the biggest issues that's come up this, if anything positive has come out of this, is the fact that, yeah, we are really making an effort in striving lifestyle changes for these patients along with prevention. And I think that that's, if anything positive can be said came out of this for my patient population, it's been this. So for that, I'm very, very grateful. Thank you.
Well, and when you talk about runaway healthcare costs, wound care is one of those places that you have a lot of preventable costs. And so we should do it because it's the right thing to do. But we should also understand that we have a real opportunity to save money and then to redirect that money to other areas if we focus on wound care. And while 170,000 dead is a tragedy by any measure, I actually am hopeful that the attention that's being paid to social determinants of health, to pre-existing conditions, to hypertension control, to diabetes control, will actually mean that 5, 10, 15 years down the road, we'll look back to this moment again, with the appropriate degree of sadness for the lives lost, but we'll also look back and say that was the time when people finally realized, hey, it is the right thing to do, and it is the cost-saving thing to do to give everyone the opportunity to be their healthiest self by addressing these social determinants of health. It will lower cancer, it will lower diabetes, it will lower high blood pressure, it will improve wound care, it will lower substance use disorder, and it will increase resilience to the next pandemic, all simply by doing simple things like making sure we have safe, affordable housing and making sure everyone has a living wage and has childcare. These are the basic ingredients to a healthy community. And I think we all can and should agree on that, and then have policies that reflect that priority.
Thank you. And next, I want to introduce you to Miguel Centeno, who's Vice President of Community Engagement and Healthfirst Foundation.
Thank you, Christina, and good afternoon, Dr. Adams. Thank you so much for taking time out of your incredibly busy day to join us. I will say that as the largest not-for-profit health insurer in New York, we certainly serve the most vulnerable populations day in and day out. And, you know, we were talking about the importance of data before. We certainly have access to incredibly rich data, not only that can help to address access to care issues, but can very effectively address those social determinants of health that you've raised as well. And in that way, you know, help to create greater racial equity in our communities, not only now, but in the long term. And let me finally just add quickly that we also are focused very heavily on maternal health issues. And so if there is any way in which we can assist you, collaborate with you to move that forward, please count on us. Thank you.
Absolutely. And thank you for sponsoring this today, being a sponsor of this today. There's a saying, if you don't measure it, you can't move it. So my challenge to you and all the healthcare organizations and all the companies out there today, the corporations, is to measure, to assess the social determinants of health in your employees, in your patients, because if you measure it, then you start to understand. I was talking with actually a CEO of a hospital a while back, and the CEO told me that he actually assessed his employees for social determinants of health and was shocked to learn how many of his own employees in a hospital were food insecure at the end of the month. Right. In a hospital, the people taking care of the people are going home, they don't have enough food to eat. But if you have the courage to look at what you're doing within your own sphere of influence, you'll never have policies that are able to move it. So challenge you to use those electronic health record systems and assess social determinants of health the way we assess all other risk factors out there for people. And thank you for being here. And again, thank you for being a sponsor.
Thank you. Our pleasure.
Thank you. And we also have Ruben Taborda, and Ruben is with the Strategic Customer Group and Hospital and Distribution Supply Chain for Johnson & Johnson.
Mm-hmm. So hello, Dr. Adams. Thank you for your service. And I guess the only thing I would want to comment is, you know, as we're in the phase 3 of our clinical human trials for vaccine development, we're having very positive results. We wanted to thank the U.S. government for all the support that they've given us, not only for giving us the research and opening up the platforms for us our researchers to dig into the data, is how we're gonna, once we get into a wide scale distribution to get this out to the public, how we can partner with your office and get people to believe that, you know, companies like Johnson & Johnson and others are not cutting corners. There's a fear that 30% of the population will not take the vaccine because of whatever the reason is. For us to get to that level of immunity to really help out on top of all the good practices that you highlighted, social distancing, masking, cleaning of the hands, the vaccine will be critical not only to just get everybody well, but to get this economy going again, right? And that's part of what we are talking here at the United States Hispanic Chamber of Commerce. The pandemic is tied to the economy, right? So anything we can do to partner, and I think, you know, even my competitive colleagues would love to do this with your office, just to get education out there to people to not be fearful that these things are tested right. It's only through collaboration that things are being sped up so fast. And would just love to figure out how to leverage your office and your name as you have the media to get out there that good word that it's going to be safe.
I'm happy to do a PSA with you all. I see the senator is still on. Whether we pull that together on a state level or more broadly, we can do PSAs, but we really need everyone to be on board with flu season this year because it's a chance to talk about vaccines in a way that the people are somewhat comfortable with the flu vaccine and to have a conversation, and it will also have an impact again on our response to COVID. And glad you're on, and particularly your role as supply chain, because one of the big challenges of this pandemic was PPE. And one of the things we realized was that this just-in-time ordering system that hospitals have for supplies, for PPE, for drugs, just really wasn't sufficient for trying to respond to a global pandemic. And it's something we need to reflect on. We need to also reflect on why certain hospitals and institutions, the haves, got some of these supplies preferentially, and the county hospitals, the places that serve the underserved, the nursing homes particularly that serve people of color, were at the back of the line. And so I think that you were in a position to help lead some really high-level strategic conversations about what the supply chain needs to look like and how it needs to evolve in the future, so that when we have another pandemic, we don't go down the same road again. Remember, the national stockpile was designed to respond to certain regional situations. It was never set up to respond to something occurring all over the country at once. And the capacity lies actually as much at the local level as it does in a warehouse here in Washington, D.C. But we need to figure out how we set up that supply chain so it doesn't increase inequity in our communities. And unfortunately, we saw that happen in the beginning of the pandemic and are just now starting to correct it for COVID, but we want to make sure it's corrected for the next pandemic and for other diseases that we have to fight.
Absolutely, absolutely. Christina, if I can add one more comment, that's a very valid, when you think about the science of purchasing, and I was a procurement professional. I was a chief procurement officer for almost 10 years for Johnson & Johnson, roughly 10 billion in spending. I got to tell you that the gravity of how you get measured is price. And price is what drove us to this PPE and issue, right? Where you put everything in one country and it's full of risk. And we got to figure out how we encourage more local sourcing, right? Supplier diversity programs like ours, like Wells Fargo, we need to have hundreds of companies have solid programs, and USHCC can be primary support of that. Because if not, the science will pull you in the direction of cheapest price. And the pandemic exposed all of that. We got to get away from just price, and you got to pay attention to local sourcing, because that is the instigator of job creation and, of course, all the good things that help with the economy. But we got to get away from this pricing dynamic that causes a PPE shortage like what we saw.
Amen, Ruben.
Thank you.
Yes, I resounding. I see a lot of heads nodding. The next members of our team, and I know your time is tight here. I just want to introduce you to our wonderful team from the Morris County Hispanic Chamber, and I will start with the other field, Hope Field, who is our immediate past chairwoman and current chair of the Corporate Advisory Council. Hope.
Thank you, Christina, for the introduction. Dr. Adams, it's an absolute pleasure to have you here with us today. Thank you so much for your leadership during these difficult times. You have become so comforting to us over the past few months. You have no idea how much we appreciate you. As Christina said,
So you're going to hire me when this is all said and done, because I'm going to need a job sometime in the near future.
We'd love to bring you on. Actually, you're one of your predecessors.
Dr. Carmona sits on the Coca-Cola Hispanic Advisory Council.
Yeah, we'd love to talk to you about that. I'm with the Office of Latin Affairs, and as Christina said, I'm also Christina Field's sister. So Murray, our family is very fond of your friend. He has become, one of us.
Fantastic. Well, thank you. And again, it's great to see corporations like Coca-Cola involved, because the number one issue people vote on, and we're coming into an election. Over the last, every presidential election of my lifetime, the number one issue people vote on is not health, it's jobs and the economy. And that's whether you're black or white, rural or urban, rich or poor. And we need to really bring these corporations to the table, understand what motivates them, and find a common language and common goals. Because I'll tell you a really quick story, and I know we're running short of time, but I talked to the U.S. Conference of Mayors, and to find out why some of them were pursuing walkable cities. And I said, how many of you all ran for office on a pledge to lower your community's hemoglobin A1C rates by 15%? And not a single mayor raised their hand, shockingly. And so I said, well, why are you pursuing walkable communities? They said, because it increases foot traffic downtown, which increases revenue, it increases property values, it decreases crime because you've got more people out and about. And at the end of the day, we need to speak to what voters care about, and that's jobs in the economy and safety and security, while integrating those health messages. And so I thank you for being at the table. I think there's a lot more opportunity for us to work together than what people acknowledge or want to admit. You know, what's funny is we met with Pepsi, and I probably shouldn't say this if I want you to hire me one day, earlier this year, and everyone said, oh my gosh, the Surgeon General's meeting with Pepsi. I said, yeah, they've got plants and people all over the country, and they have an ability to influence behaviors both within their corporation and across the planet. And my final plea to you is, let's get Coca-Cola on board with doing some national commercials on wearing masks. And they have great commercials during the Super Bowl and during Christmas. We can come up with a good, heartfelt commercial encouraging people, and particularly targeted to different communities, about why you should wear a mask and how we all need to come together. If we can do that, I think you all have the ability to have an influence in a way that I can as Surgeon General.
You have an advertisement in Times Square.
That's a great idea and something that we can explore. I also wanted to add that Coca-Cola donated $100 million towards corona relief efforts. A lot of our marketing dollars have been redirected in helping our communities. And we've also been donating plastic to make the masks for hospitals.
Fantastic, thank you.
So I'd love to continue conversation. Thank you again for being with us.
And the last, we're getting to the tail end. I want to introduce you to our chairman, Ralph Tejeda. Ralph?
Thank you, Dr. Adams, for spending time with us. We said this is a very important forum for us and for all of our members, our community, and it's great to see the diversity in the medical field. My father was a doctor. Sorry that he's not with us any longer, but he was one of the first Dominican doctors to come to the U.S. and specialize in fertility. So I'm grateful and very happy that you're with us and spreading the news. I'm also in the produce business. So regarding health and food safety, it's one of the things that the FDA is also working very hard on. We have to think of health globally, not just medicine, but also what you eat and taking sanitary precautions as well. So I really thank you for your time and thank you for being here again.
And you mentioned that you're Dominican. I think one of the other things that I really ask for your help with is how do we have messages that are appropriate to particular communities? Because unfortunately, too many people out there think of Hispanic and Latinx communities as being monolithic. They don't understand that the way you would speak to a Dominican community is different than the way you would speak to a Puerto Rican community, is different than the way you would speak to a Cuban community, is different than the way you would speak to the Mexican community, and so on and so forth. And so that's something that I would ask your help with, is to help let us know when our messaging may be off, may not be resonating, or especially when it may be offensive to certain subsets of the community, because it may be, and this happens all the time at high levels, you talk to one representative from one facet of the community and you don't realize that what you're getting from them is not representative of what 80+% of people in that broader community need to hear or have concerns about.
Absolutely, we're here to help. We also working with different ambassadors of various Hispanic and Latin countries to get together and to help our communities, because again, we are affected and we are different. We eat different foods, but we all speak the same language and we're all in this together. So we're glad to help.
Thank you.
Thank you. And then the last few are really members of this team, and without them, none of this would be happening. So Marilyn Andrade will close, but I just want to briefly introduce you. Marilyn is our Director of Activities and Events. And you're muted, so I don't know if you want to say anything. Marilyn.
Sure. Thank you, U.S. Surgeon General Dr. Adams, and to our panelists. Please also, Surgeon General, thank your family for sharing you with the world and our amazing country. As a mother of young ones can also understand the trials and tribulations, but also as a member of the Latin community, I appreciate everyone here to really explore the conversation, how it's been affecting our community. I think that's very near and dear to many of our hearts, and as well for exploring solutions. So thank you, everyone. And Christina?
Yes, thank you, Marilyn. Then I'm going to just come to Esperanza, then I'll go from there. Esperanza Porras Field. Without her, Dr. Adams, none of us would be here because it is through her vision that we are here. Esperanza.
Thank you, Christina. Dr. Adams, for the bottom of my heart, muchas gracias. Muchas gracias por estar con nosotros. Thank you for being with us. I know you speak Spanish.
De nada. Habla español un poquito and very poorly, but I try it when it's appropriate, and when I don't mean it to be offensive, but when I speak to different groups, I try to use my little bit of Spanish that I remember from high school and learned in the hospital working with patients. So muchas gracias to you, and de nada. I love conversations like this. I could talk to you all day. You can tell how excited and engaged I am.
And I'm very glad that my daughter Christina had the pleasure of introducing you. And I hope one day you can come to visit us in Morris County. Hopefully in the next events that we will do with the Morristown Memorial Hospital with Trish. Thank you very much. Muchas gracias.
Would love that. Would absolutely love that.
Dr. Adams, behind the scenes, we have Sebastian Brenes. He is our PR director. He's helping kind of keep the glue together behind. So you see his picture there listed. I don't know if you want to say a quick hello and unmute yourself, Sebastian.
Yep, there you go. I'm behind the scenes, but yeah, I always appreciate such an important group of people getting together to discuss important matters and things that matter to our community and to people suffering from this pandemic and from this whole situation, health and economic wise. So, well, especially to you, Dr. Adams, we appreciate you coming on board and joining us and sharing your expertise and your knowledge about this matter. As well as we appreciate all the panelists and participants attending this webinar. As we know, this is a difficult time, but we know that standing together, we can overcome any problems. So thank you all.
Well, thank you, Sebastian. And you got to tell me how I get a glamour shot like that. I mean, live, but man, your photo looks good.
Thank you. I'll let you know. We can gather after the call.
And I know Christina may want to say a quick goodbye.
Yes, I would love to. I just wanted to tell you that it was a total honor introducing you. Maury has, like my sister said, is such a dear friend, and he's become part of our family. Right now you have 3 fields in this panel. And yeah, we love him. And also I wanted to tell you what an amazing job you've been doing during this pandemic. You really have become a voice in the fashion industry, advocating face masks and providing tips on how to make them. So I'm truly impressed. And I don't know if you realized that you've made an impact on the fashion industry, but I wanted you to know how grateful that I feel to have you as our Surgeon General.
Well, thank you all for just taking the time today and allowing me to really, again, engage with you, because this is the fun part. This is the important part. It's not just about me coming up here and giving a speech. It's really about me learning from you and what you're doing, and me having a chance to give feedback. And I just want you to know that this is not the end of the conversation. This is the beginning of a conversation with many of you. And please know I'm here working for you, and my office is always open. Reach out, let me know how we can work together to lift up health for everyone.
Thank you, Dr. Adams. And very quickly, if I can serve you, my background is in leadership and high performance, and I know people. Hablo varios idiomas, inglés, francés, español. I'm learning Portuguese. So however I can serve there, it is my joy. And I too am honored to be here with you. And just to know that you have such a huge heart and you're in this with us, right? Because you're living it. You have kids going through school. You're going through those challenges. And I deeply appreciate that.
Thank you. Muchas gracias. Have a wonderful day, everyone. And again, let me know if there's ever anything I can do. And I really do hope to hear from many of you.
Muchísimas gracias, doctor. Closing will be Ilka Padilla. She is Director of Nominations. Ilka, if you would close our event. Thank you. And just unmute your microphone. We cannot hear you. Can anyone hear her? We cannot hear you. Try again. We can't hear you. So what I will do, right? I'm not sure what's happening. We're probably having some technical difficulties, but Ilka is our event co-chair. So as event co-chair and director of the nominations committee, we thank you on behalf of the Morris County Hispanic American Chamber of Commerce for attending su Salud Primero, the impact of COVID-19 on the Latino Community Health Symposium. Today was an historical day and event for us Latinos and Hispanos. On behalf of the Board of Directors and the United States Hispanic Chamber of Commerce, we extend a special thank you to the Honorable Dr. Jerome M, Surgeon General of the United States, to you, our esteemed panelists, our committee members and participants, and our chamber members as well. A special thanks to our event sponsors, the Coca-Cola Company, Wells Fargo, and Healthfirst. And as was mentioned at the beginning, this webinar is being recorded and will be posted soon on our website. If you'd like to have a replay, visit us at MCHACC.org. And Marilyn will type that into the chat, MCHACC.org. If you have any additional questions, please email us at info@mchacc.org. We wish you a happy, healthy, prosperous, and safe rest of the year. Que Dios los bendiga. Y recuerden, unidad y progreso. Thank you, everyone.